Acne breakouts can be frustrating, and they can also leave scars on the face and other areas of the body. Some people find that acne scars are an unwanted reminder of a painful and bothersome condition. However, acne scars do not have to be permanent, as some home remedies and medical treatments can help get rid of them. A vital part of treating acne scars is first understanding what they are: small depressions or indentations in the skin that result from moderate to severe acne. Secondly, it's important to note that there are different types, which include ice pick, rolling, and boxcar scars depending on their size, shape, and contour. Acne breakouts, depending on the severity, can affect not only the top layer of the skin but also the deeper levels as well. As the inflammation subsides and the skin tries to heal, scar tissue can ensue. Severely inflammatory acne, external factors such as picking, and delayed onset of treatment can all lead to scarring. What causes acne scars and dark marks? The spots that linger after a pimple has healed are caused by inflammation that has disrupted the skin's natural healing process. When your skin is opened up, like when you pop a pimple, and then closes back together, you can get abnormal pigmentation, texture, and tone that looks different from the rest of your skin. Sometimes the broken blood vessels that remain after an acne lesion fades can result in a mark. For a number of people who are able to refrain from picking, inflamed pimples or blemishes can still leave a dark brown or red mark, but these naturally fade over the course of a few months. Since it's pretty difficult to determine what causes one person to scar more than another, the best way to avoid scarring is to treat acne with a great skincare routine. And that means you need to resist picking, poking, or touching a pimple. The secret to seeing clearer skin lies in knowing what really works, and what doesn't, when it comes to treating darker skin types. In this video you'll find tips that science shows can lead to clearer skin. Avoid touching your face. It is a bad habit to touch your face throughout the day. You may have bacteria, dirt, and oil on your hands. If you touch your face, you may transfer the contaminants to facial skin and it could trigger acne. Touching your face also facilitates the spread of bacteria that's already on the skin to other areas. This can trigger new blemishes. Avoid popping pimples. A pimple indicates trapped oil, sebum, and bacteria. It is also a sign that the body's natural healing mechanism is working. Popping the pimple disrupts this healing process. Additionally, the released liquids expose the surrounding skin to similar bacteria, increasing the risk of additional pimples forming. The exposed pimple may also lead to permanent scarring. Whenever possible, avoid popping pimples. If they drain, keep the area clean. Wash your face twice a day and again after sweating. If you're prone to breakouts or have oily skin, don't skimp on washing your face as part of your morning and evening skincare routine. Leaving sweat on the skin and allowing it to dry can make acne worse, so it is best to wash the skin as soon as possible after sweating. Read product labels. Look for oil-free products. When cleansing skin, it's important not to use ingredients that can clog pores. Make sure the products you choose are labeled oil-free. Look for labels that say non-acnegenic or non-comedogenic. Choose cosmetics wisely. Read the labels. You know you should avoid face wash that contains oil and other harsh chemicals, and the same rules apply to cosmetics. Avoid cream foundation and products that contain oil. Choose mineral-based foundation and makeup instead. Stay hydrated. All cells in the body need water. The skin cells are closest to the environment and, therefore, may be more at risk of losing their moisture to the elements. Drinking water throughout the day may help keep the skin cells healthy. Get plenty of sleep. Not getting enough sleep may also cause your skin to break out more often. Lack of sleep could, in some instances, cause the body to release inflammatory compounds. These compounds could cause the skin to break out or worsen acne. To stay healthy both on the inside and out, aim for 7 to 9 hours of quality sleep each night. Reduce stress. It is also important to minimize stress whenever possible. Stress can increase inflammatory compounds in the body. Strong feelings of anger or emotional stress may lead to an acne breakout or make symptoms worse. Don't give up. Many treatments are available. Acne treatment works, but it takes time. If you start with over-the-counter treatments and do not get relief, see your doctor. Several prescription topical and oral, systemic medications are available. You may need to undergo a bit of trial and error to figure out which treatments work best for you. Non-medication treatment options are available too. Your dermatologist may treat acne using lasers, light therapy, or chemical peels. The doctor may treat cystic acne lesions with a procedure called drainage and extraction. The takeaway. Acne scars can be frustrating, but there are many treatments that can make them less noticeable. Most scars are permanent, but a healthcare provider can help you find the right treatment to help reduce the appearance of your scars. The best way to treat an acne scar is to prevent it in the first place. You're less likely to develop acne scars if you break out less. Avoid picking, popping, or squeezing any breakout, no matter how tempting, to prevent irritating the skin and damaging the underlying tissue, which can lead to scars.